Hi, I'm Dr. Jim Hoven from Ramos Law and your host of Health Matters. Today, we're going to talk about something every runner or running athlete should know, and it's ITB, or Iliotibial band syndrome. Stay tuned, it's going down right now. If you've been running for a long time or playing a sport like soccer where you're doing a lot of planting, a lot of cutting, you may have heard the term iliotibial band syndrome. The iliotibial band syndrome, or ITB syndrome, is really common among athletes as that tension band of fibrous tissue starts to tense up. And by the way, this is also called the tensor fascia lata, and that's the name of the muscle. So we've got this fibrous band that comes from the hip and down into the middle of the thigh, and then it starts having a tendon that goes down. So it's very little muscle and mostly fibrous band. So what happens is if we get that thing really tight, it now starts working with other muscles in your thigh, in particular your vastus lateralis, and even sometimes part of the hamstring group, and those things start working together to pull the kneecap to the outside. So if it's on my right knee and it starts pulling that kneecap to the outside, that can cause something called chondromalacia patella. But if it's not pulling that, it's still creating abnormal tension, causing lots and lots of knee pain. Now, back in the old days, they used to do a lot of a procedure called a lateral release technique, where they would take part of that iliotibial band and they would remove it in order to relieve some of the pressure and the tension. And actually, one of my good friends, Dr. Randy Snyder, was on the U.S. Olympic soccer team, and he had that procedure done, and it literally ended his career. So now, thankfully, they really are careful before they look at doing that kind of a procedure, especially for a high-level athlete or someone who wants to continue in their sport at an aggressive way. Doesn't mean it doesn't still happen, but it's far less than it used to be. So what do we do with ITB syndrome? Number one, we try to look at the entire mechanical chain from the foot up. So imagine if your arch is too flat, that's going to put pressure all the way through the medial part of your knee, and then if your hip and pelvis is rotated, that band could now be longer in tension than it's meant to, causing this syndrome to take place. So we want to look at things structurally. So when you look at your doctors and they're telling you you potentially have ITB syndrome or tensor fascia lata syndrome, they're probably going to look at a lot of things. So now you'll know why they're doing that. Also, there's direct pressure through techniques such as acupuncture, massage, also foam rollers, really big. You may be at the gym and see people rolling up and down on foam rollers on the sides of their legs. That's for the iliotibial band, and that's a really great prep work to do, by the way, when you're getting ready to do any kind of activity, is working on that iliotibial band along with, by the way, your glutes and your inner thighs. Don't neglect one portion of it. I'm really not a fan of just rolling out or working on one muscle in isolation, because what we know is that they're all connected. So when we got our iliotibial band that really seems to be the primary culprit, you can bet that there's likely some minority culprit that is running around, and it could even be as far up as the shoulder because of these fascial lines that cross the body in the back. So this is why you need an expert, someone who knows what to look for outside of just the local pain spot. But if you'll take this advice, roll out your iliotibial band, look to stretch the inside and outside of your thighs, get your glutes nice and tight and balanced, because oftentimes we're too weak on the glutes and so it creates an imbalance. Just looking at that whole structure is going to go a long way in making sure that you don't get iliotibial band syndrome. Now, if you have questions on this past this, please feel free to reach out to me. You can email me, jim@ramoslaw.com. And you can also send me any questions about other topics that you might want to talk about, because we love sharing information here. And speaking of sharing, if you've liked this or you find these helpful for you in some way, please share it with your family, friends, and those you care about. I'd really, really appreciate it. Now, go out there, get after it, roll out your legs in your ITB, and always, always remember, your health matters.